Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1. Extract 1, questions 1 to 12. You hear a consultant endocrinologist talking to a patient called Sarah Croft. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mrs. Croft. I see your GP has referred you to me.
Yes.
OK. Well, I've got some notes here with his referral letter, but it'd be helpful if you could tell me in your own words the sort of problems you've been experiencing.
OK, well, I've had high blood pressure for several years, but these last few months that's tending to get worse. I've been on corticosteroids too these last 3 years or so, and that's a result of the fact that I've suffered from asthma since my teens.
I see. But I understand you've developed several other problems recently.
Yeah, as you can see, my stomach is huge. I've put on a lot of weight and it seems to be concentrated there. And, oh dear, I don't know what's happened to my face. All this hair which has appeared, it's so embarrassing. And something else which I didn't notice at first, but which other people have pointed out to me, here, see, in between my shoulders, is this, well, I can only describe it as a hump. That really bothers me too.
Yes, I can see.
And look at my ankles, you know, they're swollen too. Something else which has got really bad is that I'm also sweating so much, even in cold weather. No amount of antiperspirant seems to help.
Yeah, that must be difficult. And any aches or pains?
Well, my back tends to ache a bit, but I take ibuprofen, which helps.
Good.
My periods used to be painful in the past, but to be honest, they're so infrequent now that the pain really isn't a problem anymore. I often feel tired, though. In fact, like really tired.
And what about your skin?
Oh, yeah. It seems to bruise at the slightest thing. And I've noticed that if I get a cut or a scratch or something, it takes ages to heal. And something else I've spotted on my thighs, see here is these stretch marks.
Ah, yes.
They're quite noticeable because they're a real purple colour. My face has changed too. I used to have quite pale skin, but as you can see, it's quite red now. And it looks, well, puffy. I mean, it never used to look like that.
OK, so there's been quite a change.
Oh, definitely. And if you look here on my neck, the skin's gone dark. Really odd. I don't know what's happening. And though I never really had it before, I've now got acne into the bargain.
It must all be distressing. I can appreciate that this is having an effect on you. Have you noticed your general mood changing at all?
Well, it's enough to get anyone down, really. And yes, I do feel a bit depressed. But the frightening thing is that I've started getting mood swings. I've never had them before. I mean, 1 minute I'm laughing and the next I'm crying, and I don't know why. It's quite alarming.
Anything else?
Well, I confess I feel, well, irritable all the time. Everything seems to get on my nerves, and I can't seem to concentrate like I used to. You know, I find it hard sometimes to do stuff in my head. like working out a sum or remembering names and things. I just hope that you can find out what's wrong with me.
Well, I'm sure we will. Now, I see you've already had some blood tests, but I'll need to do 1 or 2 more. You've had a urine test to look at your blood sugar, so I probably won't need to repeat that. We may do a saliva test, depending on the bloods.
Okay, I see. And how long will everything take? I mean, before we know what's causing the problems?
Well, I'm afraid it can all take some time, as diagnosis can be quite complicated, and we may need to take...
Extract 2. Questions 13 to 24. You hear an anaesthetist talking to a patient called Mary Wilcox prior to an operation. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
So, Mrs. Wilcox, you tell me you've had high blood pressure. So, are you taking any medications for that?
Yes, a blue one and a white one.
And do you know the names of the tablets?
Yes, so one's thiazide
Okay,
and the other one's lisinopril.
perfect. Thank you, that's very helpful. And have you had them this morning?
Yes, that's what the nurse told me at the pre-assessment, yes. So is that all right? Just with some water? I usually have them before breakfast, but she said no food at all this morning.
Excellent. And apart from the high blood pressure, do you have any other medical problems at all?
Yes, I take some blood-thinning drugs because I had a small heart attack a bit ago, so I'm taking aspirin. And at the pre-assessment, they said to keep on with them, so I had one this morning like I usually do. They told me to stop the other one. I can't remember the name.
Warfarin?
No, it begins with C. Clopidogrel. They told me to stop it a week before the operation, 7 days.
Fantastic.
So I stopped last Tuesday.
Great. Now, tell me a bit more about this heart attack. How long ago was that?
2 years ago, my GP picked up on it.
Did that all go...
Yes, pretty good.
And why did you go to your GP? Were you having chest pains?
They weren't chest pains. They were, I was just getting a bit breathless, and it was difficult for me to tell what was going on, but Dr. Scott picked up on it when I went to see him, and he sent me to the cardiology team.
Right. Did they say you'd had a heart attack?
Yes, they told me I'd had a small one, and so I had some stents put in, a couple of them.
And since they were done...
Yes, I've been better. You know, I don't feel so tired all the time.
OK. And what can you do in terms of exercising?
Well, I can do anything. Anything, really.
Tell me what you can do.
Well, we have stairs at home, and we don't have a loo on the ground floor. It's on the first floor. So I'm up and down a few times a day.
And walking on the flats, fine.
Yes, that's okay.
Any problems with your ankles swelling?
Well, this one, it swells up if I've been standing. I had my veins done, my varicose veins, but the other one's all right. I sprained it quite badly last year, but it's fine now.
Right. Can I just ask you a few other questions about your heart?
Sure.
Have you ever had any palpitations at all, when your heart goes bum bum bum?
No.
You've never experienced any of those?
Well, no, not really. I mean, if I run, my heart beats a bit faster, but that's normal, isn't it?
Sure. Anything else? Any digestive problems?
No. Oh, well, if I have a heavy meal late at night, like if I have a pastry or something, I sometimes wake up in the night feeling a bit like heartburn. But if I take an antacid, it's fine.
Right. So, in general, you sound to be in pretty good shape.
Mm-hmm.
Now, in a minute, I'll tell you about exactly what type of anaesthesia we'll be using. But first of all, is there anything you'd like to ask me? Do you have any concerns about anything?
Well, I suppose the main thing is after the operation, when I wake up. Will I be in a lot of pain when I come round?
No, you'll be given morphine during the procedure, and that will still be working when you wake up. And then, when that wears off, you'll be given something else. There'll be someone keeping an eye on you.
OK. Oh, the other thing is, I've heard that if you have crowns in your mouth, they can get damaged if they put in an air tube.
Well, it's unlikely, but we'll take special care. So, which teeth are we talking about?
These two.
OK, the 2 central incisors. And do you have any other teeth with crowns or implants?
No.
OK. So, what we have planned for you is to take...